Good morning, everyone. Very excited to have you here for Understanding Mental Health Through Every Age. I'm Johanna Dunleavy, the Wellness and Marketing Manager with Employee and Family Resources, and I'm excited to bring this topic to you for Mental Health Awareness Month. This is something that I thought of when I was kind of going through what could be helpful information for our EAP clients to access during Mental Health Awareness Month, and I thought about the wonderful people I work with at EFR and all of the valuable information that they bring every day to work and how they help our clients. And I thought maybe looking at mental health through these three different lenses could be really helpful. So I want to quickly introduce our presenters. We have Allie Conrad. She is one of our outpatient counselors, and she's a registered play therapist. So Allie will be sharing information about our kids and mental health common concerns and resources for the young kids. And Steve Arneson is our student assistance program consultant, and he is also a retired school counselor. He brings a lot of experience and firsthand feedback from our teenagers and high school kiddos. And then lastly, Tina Leaf is our EFR clinical manager, and she is also a licensed mental health counselor, and she is going to talk about common mental health experiences in adulthood. So very excited to have you with us today. I think all three of these lenses are really important to consider because whether you're experiencing things as an adult or you're raising kids or you have grandkids or just younger people in your life that are important, I think it's always good to stay informed as to what's going on and what are common experiences and what resources are available. So very excited to have my three very talented colleagues here today to share this information. I will be monitoring the chat throughout, so if you have any questions, we'll do Q&A at the very end, but don't hesitate to enter a question as you think of it, and then I'll kind of start from the top and go through the list as we get to the end. So I'm going to turn it over to Allie.
Hi, I'm Allie. I'm an outpatient therapist here. I'm going to be talking about common mental health challenges for kids. One of the biggest concerns I would say that I get from parents is understanding what is typical for kids, typical behaviors and emotions, and what is more cause for concern or things that need to be addressed through therapy or other supports. So the first one is emotional regulation challenges. So emotional regulation can look like difficulties managing and controlling emotions, meltdowns that are lasting for more than 5 to 10 minutes at a time. So as kids get older, meltdowns typically become less frequent and intense. They're more problematic when they are increasing in frequency, intensity, or are out of proportion to what the trigger was. Emotional regulation issues can look like not easily being redirected or soothed. So when they're having those meltdowns, is it hard to get them to come down from the meltdowns? Is it hard to calm them down? Are they not responding to you trying to help them? Any sort of aggression, and again, what's normal, what's not normal. Some aggression, especially towards siblings, can be a normal thing in childhood. It becomes a concern when the aggression is more constant, when it's towards parents, when it's at school, or when it's resulting in damaging things or injuring people. And then any sort of emotional regulation issues can also be a sign that it could be anxiety related. The next concern that parents and kiddos present with is defiance. And again, what is normal and what's typical of kids and what is more cause for concern. So as kids get older, it's normal for them to test out their independence and test their boundaries and what they can get away with and what they can't. It becomes more of a concern when they are losing their temper often and they're easily irritable, when they are arguing with or actively defying authority figures, so parents, teachers, when they are deliberately annoying other people, blaming other people for their behaviors. And then if parents are having difficulty redirecting and managing those behaviors, it could be helpful not just for kiddo to receive support, but parents to receive support as well. The next set of concerns surround trauma and attachment concerns. So from the ages of 0 to 3 is when our brain is developing the most. And our brain develops from the bottom up. So the bottom of our brain controls our survival mechanisms, the central nervous system, our breathing, our heart rate, those types of things. When trauma and neglect or attachment issues happen in those years, brain development can be disrupted, making it difficult for kids to access the higher thinking parts of their brain when they get older. It's a pretty common misconception that trauma can only impact us when it is things that we can remember, but that's not true. Pre-verbal trauma is stored in our brainstem and our body and can affect us as we get older. So any sort of trauma concern is anything that any traumatic event that a kid directly experiences, witnesses, or learning about it happening to someone else. And some symptoms that, you know, they may be suffering from something traumatic is themes of their trauma expressed in their play, nightmares or sleep disruption, having meltdowns, negative behaviors, any sort of emotional dysregulation that doesn't seem to have a trigger with it. Negative emotional states, difficulty with experiencing positive emotions, so angry all the time or sad all the time or anxious all the time, not responding to caregivers' attempts to soothe that we kind of talked about a few slides ago, and then hypervigilance. So what that is you know, being constantly scanning their environment to make sure there's not a threat. The next set of concerns that I see parents and kiddos present with a lot is ADHD, so attention deficit hyperactivity disorder. This can be hard to gauge in young kids because young kids do have a lot of energy. And so we have to ask ourselves what's a typical amount of energy for a kid to have, and when does it border on, you know, turning into hyperactivity and ADHD. Hyperactivity that is above the norm can look like constantly running or jumping, climbing in situations which it's not appropriate, not being able to be redirected, leaving their seat like at school if they're constantly, you know, running around the room or not being able to sit still. If they're unable to engage in activities quietly, talking excessively, interrupting, difficulty waiting turns can all be signs of hyperactivity that is above the norm for a child. Academic concerns often come with ADHD, and a lot of the times it's not because a kid doesn't know the material or doesn't understand it. It could be that they are having difficulty concentrating or focusing. They are needing more time to complete their work. They are overstimulated by everything going on around them in the classroom, and they just need some extra supports in place to help them succeed the best they can. Difficulty focusing, like I said, that can show up in academic concerns. At home or in other places, it can be having to repeat things constantly, only being able to give one direction at a time, losing interest in things quickly, not completing things, losing things, misplacing things, poor organization, and then avoiding things that require mental effort. And then poor control of body and body awareness can also be a sign of ADHD. The last common concern that kids present with is autism. So autism is a diagnosis that is described as having difficulties understanding social norms and engaging in appropriate social skills. So as kids are getting older, they're starting to go to daycare and preschool and regular school, and if you notice they're having difficulties, you know, having back and forth conversations with peers, sharing interests with others, initiating and responding to social interactions, having poor nonverbal communication, so poor eye contact, poor body language, those can be some signs that there may be concerns and something you want to look into. With autism can come repetitive behaviors, so that can be like repetitive hand gestures, rocking back and forth, repeating words constantly, restrict highly fixated interests, so you know, being really obsessed with one topic and only wanting to play with one thing or talk about one thing or research one thing incessantly. Extreme distress at small changes, difficulties with transitions, rigid thinking, needing rituals, and then sensory concerns, and that can be hyper or hyposensitivity. So hypersensitivity means that the senses are too much. So it could be that loud noises are too much, or certain textures of food or clothing are too much. Or it could be hyposensitivity, which means that they're not getting enough of that sensory. So they might seek out a lot of body touch, and that's because they may have poor boundaries with others, and that's because they are needing that touch and you know, that pressure on their body to make up for that sensory that they're lacking. Resources, if any of these things are resonating with you guys, if you are thinking, you know, I do have concerns about my child, here are some resources. For mental health therapy, of course, we have it here at EFR. We have our employee assistance and student assistance program benefits. A lot of schools will have a therapist within the school that they're contracted with to provide school-based therapy, so that may be an option. And then psychologytoday.com is a great resource that you can use to look up therapists, and you can filter it by insurance, gender, age, those types of things. Types of therapies that you might consider if you know, your child is having any of these concerns. The most common therapy used for kids is play therapy. Just allows them to use play and toys as their method of communication rather than talk therapy, just because kids don't have the words always for what they're feeling and what they're thinking. There's also, you know, different types of family therapy if the family dynamic is what is the concern. And so parent-child interaction therapy is one type of family therapy, as well as child-parent psychotherapy. And then for any sort of trauma or anxiety concerns, eye movement desensitizations, reprocessing, so EMDR, is a therapy that can help with those concerns. A couple other resources, a lot of times, especially with diagnoses like autism and ADHD, we recommend psychological testing services. It's more in-depth testing to figure out, you know, if that diagnosis fits or not. A couple places that provide that around the Des Moines area are the Blank Developmental Center, ChildServe, and Magnolia Connection. Occupational therapy can be used for sensory and emotional regulation concerns. Behavioral health intervention services is a service that is available to people with Medicaid only, but it's in-home behavioral services that helps kiddos and parents work through behaviors at home. And then integrated health homes is also a Medicaid only service. It's a case management service that helps the family advocate for the kids' mental health, and a couple places in the Des Moines area that offer that are Orchard Place and Ellipsis.
Hi everybody, I'm Steve, and as Johanna mentioned, lots of years around students, 36 as a school counselor and a coach, and then the last 6 with EFR. But I still wanted to make sure I was accurate in what I'm saying, so I did some fact checking. And by that, I actually ask students. I have occasion to be in schools conducting SAP orientations, so I ask them. So a lot of what I'm going to share with you today is kind of what I heard directly from the students. And then it's worth pointing out that A lot of what I heard were big picture ideas, not necessarily the diagnosable things like Allie just mentioned, but all of those things she mentioned would also be applicable to teens, could be diagnosed in addition to generalized anxiety or depression. But in the most general sense, what I was picking up from students is they're just stressed out. They just have so much going on. They often feel overwhelmed because of their schedules. Quite honestly, a lot of their schedule is totally out of their control. So they struggle with finding free time. They struggle with how to use the little bit of free time, that they have. I'm going to make a quick mention of another category of teens that's not really in print right here. Students who are on the opposite side of being committed and busy with schedules, and quite honestly, they're not plugged in and they're feeling apathetic and disengaged. So for those, just exposure to opportunities is important for them to be able to find something that's of interest, a hobby or, a hands-on creating, building things, sports, some kind of activity. But I just want to make a quick mention of those because sometimes the students who reported their concerns are those that are truly the most stressed out. I will say that it was interesting to find out from the students that they really do understand the struggles of social media. They were pretty honest about the negative influences, and they feel the gravitational pull a lot like we do as adults. They actually validated some current research that shows that teenagers today are more plugged in than ever socially and with world events and things like that. But at the same time, they're feeling lonely and perhaps even uncomfortable with personal interactions. Allie mentioned emotional regulation for children, and that's another concern with the teens, and it's almost magnified when they realize that they are behind their peers in managing their anger, their sadness, their normal emotions. So that was kind of an interesting thing to hear from them. When it comes to helping the teenagers, it's kind of important to understand a couple big picture ideas that they're gradually drifting from their desire to be around adults to being around peers. So when it comes to helping them, it's important to understand that they do indeed want our help, but they're just not verbalizing and asking for it. It's kind of like a phrase I sometimes will say, they want a coach, not a commander. So they want somebody that's there to kind of join them in that journey. So it's important as adults that we just stay available without being pushy, that we may never know when they want to talk or when they want to engage in a conversation, but when that opportunity comes up, we just need to be ready. Students would say, I want my mom to listen. I want my dad to listen. I don't want them to just start throwing out advice. So maybe we just stop and listen and wait for that invitation to offer our insights. It's important when I get back to those expectations that they're feeling. And a lot of times it's expectations they're putting on themselves. And I think it's important for us to remember to express our pride in their effort and focus on the process of what they're doing, not to get so caught up in the final result or the outcome. I'm proud of your effort. I'm proud of how hard you tried on that. And honestly, to understand their limitations. A lot like us, they only have so much in their tank. And there might be times when they don't have 100% to offer. They're tired, they're worn down, they're sick, they're spent. Maybe they only have 90% to give to, this project or this activity. We can still encourage them to give 100% of their effort of that 90, if that makes sense. It's kind of a math equation. So we're not so concerned that you're always at your potential best, but your effort can always be your best. And it's a lot of the same things we need to remember as far as understanding our limitations. Their journey through social media, honestly, it's a lot of the same kind of things that I am following with our adult journey. So perhaps it could be a shared effort, a family attempt to try to limit our screen time, and overall just accepting their feelings and emotions while still setting boundaries on their behaviors. A real life example that's front and center right now is transitions, because a lot of students they're excited about the end of the school year, but yet they might be anxious and a little unsettled thinking about what's next. Maybe I'm going to a new building, maybe I'm graduating. So it's important for us to remember not to say something like, oh, you don't need to be nervous, you don't need to worry, but instead allow them to have those feelings. I understand you're nervous, I understand you're worried, and just kind of be listeners. As far as indicators, things to kind of watch for, Allie mentioned what is typical, and I think it's a key way to stay plugged in with our teens. And in order to notice big changes, we kind of still have to have that baseline. So it's important to pay attention, even when things are going well, to know what is typical of my specific teenager, or this teenager who might be different from his brother or sister. And then watch for those big changes in feelings like fear or worry, anxiety, things that are bigger than usual. And then the same thing goes with eating patterns, sleeping patterns. We need to know that baseline. We need to know what is typical with their social engagement. It's normal to change relationships and to change friendships, but what we're really keying into are the big changes, the things that are really out of the norm, or like Allie said, that aren't typical. And an easy way to think about that is the big D's. As we observe distress, duration, disruption, when is it more big or bigger than what might be normal? And this is where it comes in helpful if you have another adult who knows that teenager, a spouse, a partner, a relative, maybe someone that sees them a lot, a coach, somebody at church, somebody who really understands, so you can bounce those ideas off of each other to see if indeed what you're seeing is out of the ordinary. It's important to remember kind of that we're just modeling, as we try to give advice. Perhaps the best thing we can do is just share with them our own journey through problem solving, handling emotions. When we lose our cool or when we go off the rails, to admit to it. Same thing, like mentioned, social media. Maybe join in this journey together. This age group is really unique because they're a lot like what Allie's talking about, and a little bit of what Tina's going to be talking about. They're just making that gradual transition to being independent and handling things on their own, and they're still looking for us for that role modeling. It's also important to accept that their journey is different than ours. It does no good to say, well, back when I was your age. And the other side of it's true too. Sometimes I see students who are actually getting along really well, but mom or dad struggled with relationships, or maybe was anxious when they were teenagers. And it's important not to impress our concerns on them as they kind of make their unique journey. As I mentioned earlier, and it's just important to be present, just to be available. You never know when that conversation is going to come up. It could come up while you're driving in the car, or when you're picking up from activities, or late at night when they're should be going to sleep, but they've got a lot on their mind. And it's just important, that's what I heard from students. I just want someone to listen to me, and just to know that that person's available if and when I need them. And quite honestly, it might not be us as parents, and that's not an easy thing to accept, but it's important to encourage positive relationships with other adults, relatives or people at school that spend a lot of time with our kids, a coach or a leader, somebody from church group or teachers, or somebody who you feel comfortable with, and really encourage those relationships. It's kind of a life lesson, quite honestly, that you always want to surround yourself with people who could give you advice and who could help you out. So we might as well start, allowing that when they're teenagers. As far as resources, Johanna will talk a little bit more about EAP and SAP, but I will just say it's important to remember that these benefits for anyone in the family. So as a parent of a student, you can access SAP benefits. As a child of an employee, your child can access the EAP benefits. It says school counselor there, but quite honestly, as I mentioned, anybody at school who's plugged in, who knows your student, can be a starting point. That could lead to conversations that pull in the AEA, or perhaps a school-based therapist like Allie mentioned. A couple great resources that are just available at any time for anyone is Your Life Iowa, which is kind of a great place for texting or chatting or just phone calls for anytime help. Scanlon is kind of a hub for school-based services and research and things like that. It's kind of based out of the University of Iowa. And just our own resources are great. Johanna just did a really great podcast with another one of our counselors, and they got into some great mom conversation about how to be supportive of kids. And there's a blog on there. But anyway, those are some things and places to start in looking for helping out your teens.
Good morning, everyone. I am Tina, and I will be talking about some common challenges for adulthood. But I want to take a minute and just thank Allie and Steve for the great information that they have provided. For the portion that I will be talking about in terms of adulthood, I've broken it down into what I would consider some fairly common challenges that adults face, ranging from like when we turn 18, because that is, the start of adulthood, all the way up until transitioning to being more dependent. So some of the key topics I will go over, and I'll stay on this slide for a bit, is transitioning to independence, career development, evolution of the family, relationships, how those are starting and ending, talking a little bit about the sandwich generation, retirement, and then transition to dependence. So when we talk about transitioning to adulthood, that's turning 18. It can be a big deal for people. It's kind of the rite of passage into the next phase of life. Some people really look forward to this. I know I did, but others are super ambivalent about it as well. I think entering adulthood can bring more freedom, from parents, from caregivers, but it can come with more expectations and pressures for others as well. This is the first time, think about it, that young people make independent decisions without parental consent. I think about like making your first doctor's appointment. That's something mom or dad always did. But now, it's something you have to do for yourself. That can be freeing, but it can also feel super scary. Another thing that I think when you think about transitioning to adulthood is being able to open your own credit card. That also comes at a cost. And so, young people are coming into themselves as they transition into adulthood. I think another big portion of, what's challenging sometimes for young people entering into adulthood is finding their career, entering the workforce. I've learned that more and more young people, usually between the ages of about 25 and 34, still continue to live at home with their parents. For some, attending college is expensive, and it can mean, more debt for young people. So many may choose to skip college, but they're also unsure of what career they want to pursue, which can cause stress of, not meeting the societal norms and expectations. Another challenge of adulthood is building a family, navigating relationships on our own and knowing when to start a family or if to start a family. More and more married couples are choosing not to have children. I think social media or, society has called them the DINKs, which is dual income, no kids. And more people are choosing this lifestyle, maybe because they don't feel fit to have children. Or what I often hear is, I don't want to bring kids into this world. This is a scary place. Are we financially stable enough to have children? Is it the right time for us? I think once couples do have children, they have a time of transition, into balancing, work, the couple relationship, but also parenting. Oftentimes, couples struggle to make themselves, either themselves as the individual or themselves as the couple, a priority, and we can see some breakdown in those relationships. And sometimes relationships don't make it, and they do end in divorce, which is another common challenge in adulthood. And it can lead to an array of feelings, which can result in symptoms of depression, anxiety, and substance use, which we'll touch on in a moment. Another big experience in adulthood is the sandwich generation. And this is a group of middle-aged adults who care for both their aging parents as well as their own children. This can create, I think, for a lot of people, pressure to maintain their own households and assist with their parents. And one common struggle that we find the sandwich generation facing is that not all aging adults want the support of their adult children, even though the adult children may feel obligated. Research shows that, or says that the number of children caught in this double bind of the sandwich generation is expected to grow as more and more members of the baby boomer generation become senior citizens themselves and need additional supports. Another reason that we find so many people in this sandwich generation and struggling with this is that there have been improvements to geriatric care, which ensures that people live longer. That means adult children often carry the burden far longer than their parents did or their grandparents did. Another phase of life in adulthood is getting older and retirement. Adjusting, not only to life, but our changing bodies and our ability level while preparing to leave the job force. For some, this may be hard, because we think about medical insurance needs, retirement, changing income levels. Oftentimes what I hear is that folks who enter retirement experience more isolation, boredom, and feel purposeless when they're at home. I think more and more retirees are developing symptoms of depression because of that purposelessness. Oftentimes, working can provide the emotional rewards, such as the sense of achievement and satisfaction in their day. It offers, folks opportunities to socialize and for intellectual stimulation. And when they leave the workforce, they miss some of that. Another important piece, I think the last piece in experiences for adulthood is when adults become more dependent. Life comes full circle as we age, and we maybe become more dependent on family and friends or even paid caregivers to help with everyday things. This can be an especially hard transition for someone who was once dependent and able. As adults become less able to complete, their activities of daily living, they may have to pay for caregivers or go to a facility, which can also create financial strain once again. And so as those things come up, it can also affect, mental health. I will also go over some of the common diagnoses that we see in adulthood, which can range from adjustment, anxiety, depressive symptoms, and substance use disorders. Some of the key indicators of depression are, feeling a decreased ability to feel pleasure or enjoy activities of interest. So things that you used to love to do, you just don't want to do them anymore. Like we talked about, the feelings of purposelessness, but also hopelessness. Just not having any hope anymore, can be a key indicator of depression. Irritability and anger outbursts, that are outside of the norm for somebody. Another key indicator of depression is crying just for no specific reason. That could be, a reason for looking at depression. There's also can be a sense of guilt or worthlessness as an indicator of depression, or having difficulty concentrating just on daily tasks. Some folks will have difficulty making decisions. Another indicator of depression could be weight loss or weight gain. Could also be, just fatigue. I don't want to get up. I don't want to be active, or having body aches. Also changes in sleep patterns. So it could be sleeping way more, or it could be sleeping way less. Folks also report having trouble falling asleep and or staying asleep as indicators of depression. Along with depression, folks within this, in adulthood, can also experience anxiety. And anxiety and depression can look similar, but some key indicators of anxious symptoms are feeling restless, keyed up, or on edge. So they're the people who, knee is always shaking, or they're having trouble sitting still. Could also be having difficulty concentrating again, or feeling like my mind is just blank. Irritability, again, can be an indicator of anxiety as well. Also fatigue, feeling muscle tension, also experiencing, again, sleep issues. So falling asleep, staying asleep, or just unsatisfying sleep. So when you wake up not feeling rested, could also be an indicator of anxiety. The last piece to touch on in terms of what we may experience in adulthood could also be substance use. And this is for folks who, may be using substances and they feel like they have to use the drug daily or multiple times to get the effect that they're looking for. It could be having intense urges for the drug that block out any other thoughts. So that's all they can really think about and focus on. Needing more of the drug to get the same effect could be an indicator that there's a substance use problem. Along with that, maybe not meeting obligations and work responsibilities, maybe having excessive absences because of substance use. Continuing to use the drug, even though it's causing problems in different areas of your life, could be an indicator that, maybe there is a substance use issue going on and you're needing some additional support. I think along with that, when we think about what resources, do we have available for adults, we talk about using the EAP, using the sessions to get the assessment, the brief counseling, and the referrals. This is a great way to engage in community and the supports, and having somebody to help you realize what supports are available. There's also a lot of support groups available to adults within the community, ranging from a lot of different topics. And then always, the ongoing therapy with a licensed professional who can help you navigate, whether it's the substance use, anxiety, depression, or just adjusting to these different phases of life. I think another great tool and resource for adults is Togetherall, which is an online peer support group. It's completely anonymous, and you can log in anytime. You can spend as much time, as little or as much as you want. And it's really cool because you can give and get support from folks. And so I think it is a really great way for people to connect with others who may be experiencing some of the, some similar issues. And so that is also a great resource.
All right, thank you, Tina. I do want to just mention that there's that QR code there. If you scan that, it will take you to the web page where you can register a profile on Togetherall. And as she said, it's anonymous. You will have to just identify that you're registering through your employer because anyone who has EFR's EAP benefits will be preloaded into that dropdown, and then it can give you access to the system, but no information is shared back. You created user profile. I don't even think you can create your own username. I'm pretty sure the platform generates that for you. So it's a great resource, and there's different groups you can join on Togetherall. So if you are, again, a loved one with, aging parents, or you're living with someone who has substance use disorder, or someone who's in recovery, or maybe you're a teacher or a healthcare professional and you want to connect with other people in that same space that understand what your experiences, in your work day to day are, Togetherall can be a really great platform for that. So scan that QR code and it will take you to the registration page. We have a webinar coming up in September with Tina and me. So Tina is going to kind of go into a deeper dive on those different encounters that we commonly have as adults. So whether it's parenting, co-parenting, good communication in relationships breaking down, and kind of what to do next. We're going to go into more of those common experiences, and then I'm going to help you connect the dots between what you may be going through or what you've maybe gone through, and what EAP benefits in our suite of benefits are available to help. Because as we were building this presentation and we kind of got to that slide, I thought, everything on that slide has an EAP benefit, whether it's counseling, life coaching, elder care resources, child care resources, Togetherall. They all have something that you can kind of draw a line to, an EAP benefit that is, again, free and confidential. So scan this QR code if you'd like to register. Otherwise, this will be on our website for registration. It will not be until September, but we'd love to have you join us again for that. You are here because you have EFR's EAP benefits, and I just want to remind you that we are just one phone call away at 800-327-4692, available to anyone in your household. So think about, your kids, your partner, your spouse, maybe you have a grandchild who's residing with you, but anyone in your household has access to benefits through employee and family resources, and those include the things like life coaching, counseling, that can be in-person or virtual counseling, telephonic legal and financial consultation, elder and child care resources, identity theft restoration. So lots of great resources to help. We are going to transition into questions. So Q&A. And I just had a message from someone that said the audio has no sound. So I've had two of these messages, and I'm not sure if this is something that's common or if it's unique to these couple of people. But any questions you have for Allie, Steve, or Tina, please drop in the chat and we will direct them appropriately. I think the audio issue is unique to users, and someone has left and logged back on, and the audio resumed. So that would be something to try. I'm curious to know from Allie, when young kids are in counseling, do they typically go on their own, or do they come with a parent or other adult caretaker? Do you often just do one-on-one with the kid, or do you have the parent present as well, and kind of how does that work?
Yeah, it really just depends kind of on what the presenting issue is and how much the parent kind of plays into that issue. So, if it's a kiddo who is having a lot of defiance issues at home. You know, I might do some family sessions with the parent and the kid to improve the positive relationship between them, you know, so that kiddo will want to, you know, be more compliant at home. It could be problem solving with the kid and the parent, you know, what are the reasons for behaviors at home, and how can we solve those? So it really just depends, you know, what the presenting issue is. Sometimes with younger kids, I will, you know, have parents present more often than with older kids. You know, and it's the preference of the client and the parent also.
Okay, thank you. This is a question for Tina. What tips do you have to get people to seek out counseling, especially for adults?
Great question. I think tips are, you know, understanding, I think, you know, this stigma around mental health. But I also think, you know, this idea of like something's wrong with me, and so, you know, I need to reach out and get help. But I think also looking at it from a different frame of mind around, you know, I want to do better, be better, and be healthier. You know, it's called mental health for a reason. And so it's trying to, you know, get our mental capacity to a healthier standpoint. And so I think, you know, part of it is it's really hard to take the first step and to reach out. And I tell people, you know, it may take a time or two, you know, meeting with a counselor. You don't always vibe with the first one, and that's okay, you know, but not to get discouraged. You know, I think Allie shared a super helpful website called Psychology Today. And that's a place where, you know, you can look at people, you know, different therapists, you know, the modalities that they use. You can look at their picture, you can read their profile and see if they're going to be a good fit for you. You know, I tell people, don't be one and done. If you meet with somebody and they're not a good fit, you know, try again, because there is somebody out there that can be a good fit and can be helpful. But I get that taking the first step, you know, can be super hard. And I think that, you know, using the EAP, because it's, you know, limited to 3 or 6 sessions, sometimes it's a good way to kind of get your feet wet in terms of, you know, talking to, you know, a complete stranger to begin with about what your needs are. So it can be a good preview to, you know, a longer lasting therapeutic relationship.
All right, thank you, Tina. And this next question is also for you. How would you help someone get over the disappointment as a young adult who is not at the stage of life they hope to be? So how to kind of work with a young adult who is not at the stage of life they hope to be. Before you answer, I do think the life coaching benefit could be great for this. I think counseling could help too, but we have a life coaching benefit that I think would be perfect for this, because oftentimes it focuses on kind of long-term planning and kind of where you want to see yourself. But from a counselor's lens, what are you thinking for this one, Tina?
I think the life coaching is a great benefit. But, you know, from a counseling perspective, you know, it's also understanding where does that perspective and pressure come from, right? And so understanding that oftentimes, you know, maybe I'm not measuring up because this isn't what my parents wanted for me, or this isn't what society wants for me. I focus a lot on what do you want for yourself, you know, and taking the small steps to make it happen. I think, you know, oftentimes we can get overwhelmed by the big picture of where I'm supposed to be when I'm 30 years old. But what can I do each day to focus on getting myself there, I think is also important. You know, so breaking it down, not always looking at the big picture, because that sometimes feels unachievable. But if you break it down into actionable steps that you can do each day, each week, each month to get you to what your goal is, I think can be helpful.
Thank you. That's great. That's a great suggestion. Well, we are over our time and I don't see any more questions. So I'm going to end the webinar. And I just want to, again, thank Allie, Steve, and Tina for their contributions to this webinar, and also just general contributions to EFR, helping all of our clients and students and families get the help that they need. So again, the 800-327-4692 number is available 24/7, answered by master's level clinicians, meaning if you call in and you are feeling kind of in crisis mode or you need to talk to someone about your mental health in the moment, the person that answers the phone can certainly help with that. So happy to have everyone here today. That webinar for September 11th will be up on our website to get registered for by the end of the day, as will the recording for this session. So make it a great day, everyone, and thank you for joining.